Welcome to the NeuroCog Podcast, a human-focused series framing autism in the process of differential diagnosis from a historic to modern-day perspective. I am Dr. Maya Gittleson, a clinical psychologist and founder of Gittleson Psychological Services in Los Angeles. I specialize in children and assessments for developmental skills and autism spectrum disorder across the life cycle. I'm passionate about helping families understand autistic neurology in a way that feels human, empowering, and practical. I do this work because every child and every family deserves clarity, support, and the tools to thrive. I'm joined today by two very special co-hosts, my dad, Dr. Jay Tarnow, founder of Tarnow Center for Self-Management in Houston, Texas, and my friend Neil Hughes, a savant with autism and founder of Enscape, assessment and training company based on narrative medicine. Today, our focus is assessment, what it is to get assessed, what it is to assess and thrive. Well, let's start 3. But first, a few of our favorite highlights. Let's start 3 years old, because those are my little ones who come in. They're 3 years old, maybe not even 3 yet. They're like 2.5, right? And I love that parents enjoy when a child's very independent, child that you can work from home and they don't need you.
Okay, yeah.
Can we start there?
Yeah.
The 3.
I'm getting defensive, sorry.
Oh, sorry.
No, I'm saying that's...
Okay.
I spent a lot of time alone. You just told me you've spent years looking at people like me, and you want to spend time with me. Do you know how validating that is?
Well, you're very interesting, Neil.
I'm not okay with that. I go a little bit deeper and find out what's at the core of all of this. I'm really finding a lot of the times it's the rigidity that's at the core of it. Their difficulty shifting mindset, shifting attention. Their difficulty that they're not co-regulating with their parent. That's why they're being oppositional.
Being oppositional can be very protective, right? Because you're protecting yourself. And being able to connect with the parent who, like as you point out, feels so guilty, and they feel guilty and ashamed, and they always feel that it's their fault. Part of the whole process is helping them let go of that shame. 24 hours a day, 7 days a week, that you're helping your child in terms of this development. But the first thing you have to do is forgive yourself.
So Maya, when you're talking about this difficulty of writing reports all the time about diagnosing kids, for parents,
right?
That's what makes me excited, is we're going to be able to talk about, from your perspective, what is it that both parent and child could benefit from before entering an office?
Well, I get that question a lot. Parents will say, what do I tell the child before we come to you?
Right.
I don't want too much to be front-loaded or, primed too much, because I don't know if the parent really understands what we're going to be doing.
Right.
And sometimes the rigidity sets in, and so the child expects it to be X, and the whole process is something totally different. So it is a hard question for me to answer when parents say that. I work with a lot of younger kids, so I'll bring in play that you're coming to a play doctor. I try to call my office a playroom when I go and greet the child. Let's go into the playroom. Try to get away from the medical model of it.
In my mind, I'm visualizing all of these ways we can do that with social media, so that people are prepared to visit offices like this.
Right. I mean, preparation is key. At the same time, it has to be ways that are effective, that really line up with the actual process. I can't get it out of my mind that I read about a person's experience of visual schedules. And I'm a big proponent of visual schedules, and I read it once from a perspective on the other side that don't give me a visual schedule, because unless you are going to follow it exactly, and in this world, things can't always be predicted and exact. We don't want visual schedules, because we get locked into the visual schedule, and then life happens and it doesn't happen exact, and then they really fall apart. And no one understands that, because they prepped them and gave them a visual schedule. So that kind of goes back with prepping for the evaluation. I don't want it to be so concrete because not everything's going to be exactly the same in our evaluations.
Right.
I'm trying to train my students right now, my practicum students, that you can prepare for who's coming in, but every day it can go in a different direction. We might have a kid that doesn't even make it into the office and we are in the hallway the whole time. So it's hard, that's a hard question when parents say, how do we prepare and how to bring the child in? I think showing the environment could be one option. Seeing pictures of my office or a video of the office could be really helpful. We take off shoes at my office. So we have started in the pre-call explaining that to parents so they can prep the child about taking off shoes or bring socks with them and things like that.
Right.
And so those are the main things we do to prepare. But I think it's really hard if it's a concrete concept for at least the children I am evaluating.
Right. And Jay, with your clinic, how does that play out what Maya's talking about?
I was just going to say, Maya, it's interesting because this is helpful to me because neuropsychologists have a plan and it's structured and organized. And even though I'm a medical doctor, I have ADHD. And I find the value is having the parents and child come in and just talking about how they got here, what they understand, how they feel in terms of what are they afraid of also. But I start by just observing and watching everything from them being in the waiting room, walking down the hall to my office and how they interact, how the parents are supporting them or not supporting them. And in terms of the big question is, what did your mommy and daddy tell you about coming today? And I'm always amazed at the number of kids who say nothing. The parents didn't say anything at all and didn't prepare them whatsoever. And all those pieces about that preparation and walking in and how they walk in and how they interact with the child is important data for me. Even though I'm a psychiatrist, even though I'm an MD, even though I'm a child psychiatrist, that whole family process is essential. Because I can't make a plan for a family if I don't really understand them and connect. Yeah.
No, it's key. I mean, you're right to say for neuropsychologists that are doing these neuropsychs, they don't find that important. From my experience or I should say, hearing parents' experience, they don't find that piece important. I was just interviewing a candidate for my postdoc position for next year, and she's been trained in New York, and she was telling me how her supervisor is telling her, with neuropsych testing, it's all about the data and the numbers. She wrote a whole paragraph about observations, and the psychologist who was her supervisor said, we don't need that. She didn't want it in the report. And so in her interview, she's sharing this with me, and I said, okay, do not get brainwashed. Follow her lead because you wanted her to sign off and she's your supervisor. I don't want you to go against her, but you cannot get brainwashed because when you come to my office, it's all about the observations. And, and that was just really eye-opening, to keep hearing these people's perspective, the parents, this postdoc candidate, that people are downplaying the observation piece. Parents will actually go back to the regional center, because I do testing for the regional center, and tell them I was only in the room with them for 20 minutes. And I'm done defending myself because, it is what it is at this point. You can't argue with parents, but they don't realize I've been watching them in the waiting room. I've been listening to them in the waiting room. At the regional center, I used to have a 5-minute walk with them on the elevator. And all of those observations are part of the assessment. They only feel like when we sit down and you're doing the testing with the child. And that's really not even how I make a diagnosis anymore. After doing this, for the 15 years, every single day, I actually do a diagnosis away from the data a little bit, more from the, relationship with the parents or the observations of just the walk. you know.
Well, now I'm curious to see what you're both looking for. What does an observation look like on that assessment day when you're in the elevator? What does that?
So I'm looking for if they reference it. I mean, it depends on the age.
Sure.
It depends on the age.
Let's do it by age. So
Okay.
let's go 6 to 9.
Oh, let's start 3. Let's start 3 years old,
I love
because
it.
those are my little ones who come in. They're 3 years old, maybe not even 3 yet. They're like 2.5, right? And I love that parents enjoy when the child's very independent, right? A child that you can work from home and they don't need you.
Okay, yeah.
Can we start there?
Yeah.
So the 3.
I'm getting defensive, sorry.
Oh, sorry.
No, I'm saying
Okay.
I spent a lot of time alone.
Well,
Because I was very independent.
Right.
Because I was focused on.
Right, which I love independence, and I think that's needed, because if you flip to neurotypical children, they are bored when they have independence. When no one's paying attention to them, it's boring.
And I don't like when people are paying attention to me.
Right. So, but flip to a 3-year-old,
Right.
and the parent is coming to me, and I'm trying to observe and show they should need you more.
Right.
A neurotypical developing child should seek you out.
Right.
They should reference you.
Right.
They should be looking up when something occurs in the room, to check in. That's just that.
They shouldn't be zoned out at 3 years old.
And it's not everyone is zoned out, but they don't see the reason to connect.
Yeah, I know what you're saying.
Right? So there's no motivation for them to connect. We know you're here, Mom, but why do I need to come and show you the car I just found in the room?
Well, is it a problem of parenting that you only have the kids that you have, or you're literally seeing hundreds of kids a month?
I see 10 to 12 new kids a week.
Yeah.
Brand new kids.
So 13, how many years?
So I've been doing this for 15 years.
So how many hundreds of kids that can't connect? You've seen it.
Oh, that can't, out of all those kids?
Yeah.
I don't know what percentage.
I know, I'm just saying you've got more experience than the parents.
Correct.
And Jay, how about you? What's your timeline with working with kids? When did you start working with kids?
I started working with kids about 45 years ago.
So you might know a thing or two about observations.
Yeah, and that I think that it's interesting. With even though I have ADHD, I make a lot of observations about nonverbal communication and about connection and a feel for people. And it's interesting because my dad jokes with me that he realized that he's the one who trained me to be a child psychiatrist. And the reason he said that is because he didn't talk a lot. And as a result of it, I had to really connect with him to get an idea about where things were, where he was, and what was it about. And he would describe himself as having a language disorder, an auditory processing disorder like I do. And so as a result of it, as he pointed out, he had to depend on his ability to connect with people and watch people and be careful. His father died when he was like 9 years old, and he had to go out and earn a living quite soon after that. And so he had to be very careful about people wandering the streets of New York City, and being careful about sizing people up. And then the other part is about connecting with them, because if you connect with them and you get them to like you, then they won't hurt you. So a lot of that in terms of me is very much connecting with people and feeling them and getting a sense of who they are, and I actually tell my students when they come in here, medical students and residents and fellows, I'm going to tell you that you shouldn't copy me about how I do this, because I do it after many years of developing my style. And so I'm not going to do a formal mental status examination and all those formal questions that you ask. What you're going to watch is I'm going to weave everything into the conversation so I get all the data, but that everyone feels that this is just a casual living room conversation that we're having, and that you're not on trial here, or, I'm not going to make you feel overly focused on. So that I'm much more different in terms of it. That's why I like working with neuropsychologists, because they get to have all the data for me. and why I have a lot of forms before people come in. So I have the data in front of me, so I know what I need to know, and that's in the forms. But really what I want to know is who the people really are on all aspects of it. Not just the child, but the parents. And I even love when siblings come in. So for me, I love family therapy, and I love family evaluations and seeing everybody, including the dog.
Well, that's where when we met, it was at the Susan Summit in Northern Cal. That was, 2 weeks ago? And that's been my experience with both of you. And I said, when we met, I said, oh, you are generationally, chronically open-hearted. I diagnosed you guys as having open hearts, that there's this openness to both Maya and you, Jay, and you're saying it's an aura. I'm like, it's even more than an aura. It's that connection that is immediate. So I stood up and they said, this is the person to talk to about autism. I didn't expect that. What I really didn't expect is the two of you to come find me and then suggest we start doing stuff like this. Because what I would like as a 15-year-old in 1985, I would have liked either one of you to talk to my parents and do some observations in the elevator. That's something I never had. And I've been assessed my whole life because of that, because I didn't find people like you. Does that make sense?
Maya, yeah, it's interesting because Maya, like you were talking about, it doesn't make a difference to Maya where we do the treatment or the evaluation. There are a lot of kids that both of us see who won't come into the room, who will sit in the parking lot in the car. And the two of us will just go out in the car and get in the back seat and talk with them. It doesn't make a difference to us. Wherever they are, we'll meet them at their place and be able to help engage them to realize, we're not ogres and we're not mean, or we're not the monsters that they worry about.
Right, which is, different from, some of my colleagues who I hear won't do that, because I think it's either their safety, out of the office, or they were trained in that more medical model that you need all your tools, and, that anxiety of the child not cooperating and I can't test them. I've had a lot of reassessments come to me because the initial psychologist wasn't able to do the assessment or stop the assessment because the child wasn't cooperating.
Right.
And I've just found, I don't know if I would have done this, when I was younger. To go off what you said, Dad, is you have to have the experience, and they don't teach you the experience in school. They teach you to, hold on to the tool and just go through the standardization of the tool, and then no parents in the room, because it'll compromise the integrity of the test. So kick the parents out, have your 3-year-old in the room, and get all the data and do it the right way. Don't sit on the floor. You have to sit at a table. You have to ask the question exactly how it says in the guide. And I guess that works when you are assessing children that maybe don't even need to be assessed. Because majority of the children that I see that need assessments are not in a box wrapped with a bow and handed to me ready for assessment.
Not compliant.
Right. The non-compliance gets me. I mean, I will have evaluations because I have to read the records. And I will have evaluations on a 3-year-old, 4-year-old that says oppositional defiancy disorder. I'm okay if you're going to describe in the observations that the child was not as compliant or,
Yes.
not following the demands of the assessment, which I say a lot. But I am not okay with the diagnosis, meaning you went through the diagnostic criteria and decided to give this child oppositional defiancy disorder. It based on perhaps the experience in a testing environment that you just made a standardized, sterile room setting.
Yeah.
And then listening to the parents that this child is just saying no to everything and dysregulated. And, and that's, you come, and then the teachers fill out the forms and then you come with this diagnosis. And I'm not okay with that. I go a little bit deeper and find out what's at the core of all of this. And I'm really finding a lot of the times it's the rigidity that's at the core of it, their difficulty shifting mindset, shifting attention, their difficulty that they're not co-regulating with their parent. That's why they're being oppositional. They're dysregulated and the parent's dysregulated and,
right.
So I really approach the assessment process differently than I think most, but I think it's also been because what I've learned over all my years of doing this on repeat as well.
Yeah.
Well,
Maya, and Maya, the other thing is, and Neil, being oppositional can be very protective, right? Because you're protecting yourself. And when you walk into a chaotic situation, or if your family's chaotic, the only thing you can do is to be oppositional to create order for yourself. And that's an easy thing to say, right? Because you're in a chaotic situation and it's really easy to say no. And I think that's the sort of the respect that the two of us have, because when we see that, what I'm interested is, okay, it's all right at your time when you're ready, and giving the child back that order and control really helps them. And I think the other thing that I'm really, and Maya does the same thing, is we just love connecting with people, as you pointed out. I'm 78, and the reason I'm still working is because I love connecting with people, and I love doing what I do, in that terms of that connection. That's the essence of both diagnosis as well as treatment. And so that's why we don't get too structured, and overly structured in our evaluation, especially the first time when you got there. It will all come out. You just have to wait a little longer.
Right. But when you're an evaluator and not seeing the child or the family for therapy, you don't have time. That's one of the things that is tricky. With a good evaluation, I guess you would spend more time and draw it out over a series of time. And some people do. They will go to the evaluator, over 5 sessions. But I also feel a lot of that is not spent on making the connection. So it's getting all of those assessments done. And if your child is performing and complying, guess what? Will get done faster. I don't know if that's the goal, to get done faster, right? If you haven't made the connection.
What percentage of the people come to you that have already had assessments and they're looking for more information because the other ones were flattening the child, they weren't supporting the child? Does that make sense?
Yes. I mean, maybe 30%. I mean, a lot of the 3-year-olds haven't had very many assessments,
right.
But the older, for about 3 years, I stopped doing intake assessments for the regional center that were the ones that 5 and older per se. I got burnt out how complex and how much, what I would say, noise is happening. And then I have a passion for starting younger. I feel like I can be more effective maybe, in their journey.
I would have preferred not at 15, but at 3. My first test was at 9.
At 9.
And then I had to run in when I was 15, and then later in life, I had more testing.
Right. I loved, and I got really into loving the 3-year-old process because I know maybe that's because I feel I could make more change in the 3-year-old. The, 10, 12, 15-year-old has had so much noise and so much stuff going on. The differential is very tricky. It's a lot of work to do a differential at that age.
What about at 51? You ever done one at 51?
Yes. I actually have. The beauty of working contracted at the regional center is when I first started, not so much right now, there's so many of us, we get to decide a little bit of what's our specialty. But when I first started, they looked at me and said, you will be assessing a 3-year-old and maybe a 50-year-old the next hour. It's all over the map, and you have to be prepared in your trade of how to do any assessment within these different age ranges, because we get every age. And so that was really nice because I've seen 40-year-olds, 60-year-olds. I actually had an elder man come through with his brother because now the common story is now the mom passed away who was caring for the brother, and now it's the responsibility of siblings. So they're getting all the assessments done. It's what's tricky about older is not everyone has their records.
Yes.
So I'm talking about the here and now, but because our assessments are so much about the history and development,
yes.
You have to have records.
Well, this is what's funny about my case is that in 79, my brother David, which is my roommate throughout my life, me and my brother David are doppelgangers, right? We're like twins. We both get neurocognitively assessed at George Mason, but he's an orthodontist. So he's a pride and joy of my mom, and his assessment isn't there anymore. But I've been federally disabled this whole time, and I've been a pain in my mom's ass. And she's held on to that assessment. She always brings it up. And I'm like, during my formal assessment at age 51, Dr. Brand says, I need to talk to your mom. I'm like, you won't be able to talk to her. I'm able to talk to her now after a lot of years of what you were saying about learning how to co-regulate. I had one of the best conversations of my life with my mother because I acted like an assessor. I said, I'm doing this for Dr. Brand. It's not personal. I'm not judging you, but please tell me the story. And in that story, she told me about how she met her husband, my dad, and it wasn't what I'd been told. It was all this other stuff. I'm like, oh, I'm actually getting my mom back. The formal assessment and interviewing her as the supporting parent, because you have to observe both child and parent, that was a gift. And she said, well, I had both you and David assessed, but David's worked out. I'm like, then what is the assessment for?
Right.
It's to make the collateral that it wasn't my mom's fault.
Right.
And I said, Mom, this isn't your fault. This is about clarity.
Right.
What do I need? And in the report, it says I need a quiet space and I'm super focused. Well, we didn't follow that. You're dyslexic. I'm like, it doesn't say I'm dyslexic. But she wrote the story like Jay's saying, that's protective. So we have this, kids are defiant. Well, the parents can become defiant because of how they're treated. That's my purpose in being here.
Right.
Is let's give people the language of support and strengths and deficits and medical need and the social context. Like there's all these different ways to look at it. But at the end of the day, we're humans needing support.
Right. Including the parent.
Yes. My mom needed support. She didn't need her 51-year-old son supporting her.
Right.
She needed you. I would have had a different life at any point along the way when I was being assessed if they would have been able to be open-hearted with my parents and not shaming them and not all that other stuff that happens.
Right.
So I have a condition and I have a context for that condition. And we need to look at both sides of that. And that's why I'm excited, because you guys feel like me. To me, you just told me you've spent years looking at people like me and you want to spend time with me. Do you know how validating that is?
Well, you're very interesting, Neil. That's what we like. I mean, in terms of just interesting people, not just you, but I'm just saying is interesting people.
Yeah, I'm saying I want more people to have time with you. And if it's through this conversation, then what a win for everybody.
Yeah. Yeah. The developing of that relationship and connecting is so important, and being able to connect with the parent who, like as you point out, feels so guilty, and they feel guilty and ashamed, and they always feel that it's their fault, and part of the whole process is helping them let go of that shame, and realizing, hey, this, as I say, this is so complicated in terms of you being human beings and our brain that we still don't understand these things. And, and especially if we talk about, for instance, autism, that it's part of it is genetic, part of it is medical, part of things occurred in utero. There are things that beyond our control and your control. And so therefore, in terms of taking blame, that's not what this is about. What I would like to do is, and I guess it's something that is very much in our family, which is about not making judgments about people, and trying to accept people for where they are, and not being judgmental. And I think that's what is so important, being able to get across to the parent. And like one of the things that I say a lot, this must be incredibly difficult for you. How do you do it? I don't know. I don't think I could do it. To be able to deal with all that you're going through and dealing with. What I'm going to try to do is I'm going to try to teach you about how to be a therapist, and be a therapist so that 24 hours a day, 7 days a week, that you're helping your child in terms of this development. But the first thing you have to do is forgive yourself. And I think part of that is going through a grieving process. And I think that's the thing that Maya and I get to see when people come in, is they really haven't, they're so many times in denial, or they come in anger, right? And the grieving is denial, anger, bargaining, depression, acceptance. And I assess where they are in that process. And it's usually denial or anger. And then being able to understand their anger, and about maybe this is a little different way that we can move this to the next stage, which is I'm going to give you some things that I think could help, and giving them some hope. But remember, Maya has been my best teacher in a lot of ways, because Maya is the person who taught me the most about oppositional defiant disorder. And not that she had an oppositional defiant disorder, but she was very, very oppositional, and was very firm about what she wanted and how she wanted to do it. And me being a doctor, I guess we come with a lot of authority, and try to play power trips. And I realized that none of them work with Maya. And so that's what really taught me, that you can't do the white coat power trip of a physician to really connect with people. And that's why I really appreciate, from our relationship, about how much I've learned about myself, but also about raising kids and evaluating children. Maya and I joke, which is her older sister is perfect. And we used to joke about how she's so perfect and does everything right and follows the rules and does all those things. So when she was born, I thought that, oh my gosh, I am the best parent in the entire world. Look what I created, this perfect kid, right? And then when I had Maya, I realized, oh, hold it a second. There are different type of people. So the reason I became a child psychiatrist is I thought I was a perfect parent with my oldest, Sonia. And then Maya came along and taught me, oh, there are a lot of different ways, a lot of different people, and I need to learn from this child. And she was a great teacher, but teacher of being a parent, but also a teacher of being a child psychiatrist.
Are we good?
You should be able to hear you now.
Do you hear me? Do you hear me?
Yeah.
Okay, perfect. Until next time, we're here for you.
This podcast is for general information and entertainment only. It is not medical advice and does not create a patient-clinician relationship. Always consult a qualified healthcare professional for diagnosis and treatment. Thanks for listening. Are you still there? Come on. It's time to go. Go do your stuff.